Good afternoon, everyone. Welcome to our webinar session. Thank you for joining us. We have a very exciting topic today. It's a really great innovative therapy that we are offering in the clinic to treat orthopedic conditions. It's just one of the treatment armamentariums that we have that's non-surgical treatment for your orthopedic injuries. We're also very excited today because we will be introducing our newest addition to our clinic, Dr. Diaz, who will be presenting the webinar slides today. So without further delay, I'm joined by Dr. Chris Rogers, the founder of San Diego Orthobiologics Medical Group, and Dr. Diaz. I'll have Dr. Rogers introduce Dr. Diaz.
So we're pleased to have Dr. Diaz join us. She also is is a board certified physical medicine and rehabilitation physician. So for those of you who don't know what that is, that means that after medical school, we all went on to specialize in non-surgical orthopedics. She's also board certified, as you'll see, and fellowship trained in interventional spine care and sports medicine. So she brings with her lots of experience in the area of non-surgical orthopedic care. And as you know, that's our primary focus, is to help people avoid surgery when possible, accurately diagnose them, and then offer treatments that are safe and effective and based on the scientific evidence. And that's what brought us to shockwave. So shockwave therapy, which Dr. Diaz will be speaking to today.
All right, I'm trying to get to my play button, but it's not making me play. Give me 1 minute here.
Sure.
Dr. Diaz, you might want to say hi while we're trying to.
Yeah, I'm Dr. Diaz. I'm very excited to join the webinars after some time. I joined the practice and I'm very excited to be here today with Dr. Rogers and Dr. Ambach. Definitely this is the dream job of anyone that goes into physical medicine and rehabilitation, trying to and succeeding in treating musculoskeletal conditions with non-invasive procedures and non-invasive treatments, and cutting-edge treatments that we're learning day by day. We just keep adding them to our toolbox to offer to you. So today, I'm going to be talking about healing orthopedic injuries with BioWave therapy. When I say BioWave therapy, it's going to be the same as shockwave therapy. So some of you might know what shockwave therapy is. Some of you might have never heard of this before. So I'm going to try to be somewhere in the middle in terms of like very simple, straightforward, but at the same time, throw in a little bit of the science behind it, because I know some of you also like the sciencey part of it and papers and research and all these things. So I'll do a little bit of a mix of everything. Next slide. So this is a little bit of an outline of what I'm going to be discussing today, so you know what to expect from the webinar. So first of all, I'm definitely going to explain what BioWave or shockwave therapy is. I'm going to differentiate between two different devices that we use to offer this type of treatment. If you see here the pictures on the side, the one on the top is the radial pressure wave device, and the one on the bottom is a focused shockwave device. So they might look a little bit similar, but they definitely serve different purposes, although we use them together in most of our treatments. I'm going to talk as well of how does this therapy work, what type of conditions can be treated with this therapy. I'm going to go over simple, straightforward research that show the efficacy of this treatment. And also at the end, I'm going to explain to you, if you do decide to come into the office and have this type of treatment, what to expect in the sessions when you come in. Afterwards, I'll give you a little bit of a summary. So if you miss a couple of things, the last slide is going to be your best friend. It's just going to give you all the information that you need to take home from this webinar. So I hope that you learned something new today. At the end, we're going to have some questions all of us are going to be available to answer the questions, Dr. Rogers, Dr. Ambach, myself. So while I'm doing the presentation, feel free to put in your questions in the question and answer part, and we'll get to them at the end when I complete the presentation. Next.
So, a little interruption. Sorry, there is for the attendees. There's a small Q&A button at the bottom of your screen, so that's where you can type your questions while Dr. Diaz is going through the slides. And if we feel it's appropriate, we can interrupt her and answer your questions right away. Otherwise, we'll get through all the questions at the end of the presentation. So we're wanting this to be about 20-30-minute presentation, and then the rest of the time, another 20 minutes for question and answer. There's also a chat button, and you can also write your questions in there. So you've got two options there.
Okay, so let's start. So what is shockwave therapy? Over here on the right, you see that this is the actual machine that we own here in the practice with the different devices attached there in the right side. Just so you have a little bit of an understanding, the shockwave therapy, sometimes we use some terms interchangeably, extracorporeal shockwave therapy, extracorporeal pulse activation technology, and BioWave. They're not all exactly the same, but we're probably going to be using them in the same context. So if you want a one-liner in terms of what shockwave therapy is, a simple definition is using sound waves to accelerate tissue healing. So if we can produce some sound waves that reach the injured tissue or injured body region, then we can promote some healing. And this is a non-invasive, evidence-based option to treat musculoskeletal disorders. The shockwaves are generated through this machine. It's called extracorporeal because it's generated outside of the body. And then it's transmitted through the handpiece through a conduction gel to go deeper into the damaged tissue that needs some help in terms of healing. Next. So a little bit of the history of the shockwave therapy. So this was initially developed in Germany in the 1980s. And if you see, this is very different from what we use now. So over here on the right, you see a metal tub. The patient will have to be submerged in water inside of the tub and to get treatment. The treatment was directed to treat kidney stones. So they will focus that those sound waves, that shock wave, directly to the kidney to fragment those kidney stones. It was later used in orthopedics because as everything in science, they saw that when they were treating the kidney stones, they saw some changes in the surrounding soft tissue and bones. So then they did a little bit more research and figure out that there could be good changes in the soft tissue and orthopedic use for this type of therapy as well. So this was more a little bit later in the 1990s. Usually it was used more in Europe and Asia. And you'll see that most of the research papers originally were coming from Europe and Asia, and hopefully we'll continue to get more and more use of this here in the United States. Next. So the shockwave therapy produces mechanical sound waves. When you're here for treatment, you're actually going to hear the machine, and then that creates some audible sound waves. So just imagine when you throw a pebble in a lake, you know, it causes some ripples. Those are kind of waves. And if we can get those waves to get into the tissue, it can create some mechanical changes as well as biological changes in the tissue that we're treating. So there are different frequencies of sound. Most of you might be familiar with ultrasound. Ultrasound is that if you've been here in our office, we use that machine to look into your muscles, tendons. Most people know it from when doing the ultrasound to see babies in the mother's belly. But all of them are different frequencies of sound. So the audible sound is the one that we use during shockwave therapy. These are short pulses that are directly targeted to penetrate into the painful areas or tissues. Next. So this is looks like a kind of complicated graph, but I just wanted to bring it up because when you hear that this was used for fragmentation of kidney stones, it sounds pretty aggressive. The line on the bottom is the amount of energy that is needed to break some tissue, to break down some of those stones or kidney stones. If you see the ones are in the blue circle, those are the changes that we're trying to get with the shockwave. And so basically it's more creating cellular regeneration, decrease pain, treat joints. So if you see the lower part of the graph, those are lower energy shockwave when compared to the ones used for stone fragmentation. Next. So these are the two devices that we have here in the office. One is called the radial pressure wave, the one here on the left. And then the other one is called the focused shockwave therapy. So they look similar, but if you see the drawing of how those waves come out of the device, the radial starts smaller and then it kind of like opens up and covers more area, while the focus, as the name suggests, it goes and localizes a little bit into specific tendon or soft tissue or joint. So that will go deeper and into the injured body region. Next. And this is a side-by-side comparison on how these two different devices work. So let's start with the one, the focused shockwave. The way that the shockwave is generated is through an electromagnetic generator. So there are some coils in there that use magnets and electricity to create or that wave that is gonna help with healing. This is like a higher energy density and it's really fast. This wave will penetrate deeper into the body or injured region. And it's important to know that this specific one is a class 3 medical device, which means that it only, it requires that a physician supervises the treatment. The one on the right is the radial pressure wave. That one works a little bit different. It has a small projectile inside and it uses compressed air to go up and down to create those waves. So this is a lower energy, a slow impulse. And it's mostly used more for regional therapy as opposed to more like deeper injuries. And this slide looks a little bit busy and complicated, but I just wanted you to focus on the blue oval here on the bottom. When you compare the focus and the radial, you see the focus goes deeper, as we said before, which means that it's going to have some effect at a cellular level. It's going to have changes as the biology of the soft tissue that we're trying to target. Meanwhile, the radial is going to be more superficial and has more mechanical changes, which I'm going to go over a little bit in a minute. So how does this work? The official term is mechanotransduction. All that means is that there's a mechanical stimulus, in this case it's the sound wave, and that sound is gonna reach the cells, and that is gonna give basically those cells a message to have a biological response. So we can change kind of the conversation between the cells. It kind of is like a nudge to the cell inside of the tendon, or soft tissue, or joints in order to create and promote some healing. So basically, a shockwave can be considered a biological therapeutic tool because it's causing changes at a biological level. This, I think, is one of the most important slides because it's a good summary of why and how the shockwave energy works. So there are two ways that it can promote healing. So there's a mechanical component and there's a cellular stimulation component. So starting with the mechanical component, there's a decreased level of substance P. I know many of you don't know what that is, but substance P is basically a neurotransmitter that facilitates or is used in the perception or it causes the perception of pain. So if we can decrease the substance P, we can decrease the pain. Also mechanically, we can increase the blood supply to the area. You'll see when we do some of the treatment, you might have a little bit of reddening of the skin. That's increasing the fluid, the blood flow to the area, and that causes muscle relaxation. At the same time, it causes what we call a gate control mechanism, which basically stimulating other nerve fibers kind of distracts from the actual pain. So if you hit your funny bone or your elbow and you start rubbing it pretty quickly, so you're kind of convincing your body that kind of distract from the actual pain. So that the shockwave can have that effect of basically stimulating some nerve fibers, so other fibers don't have that much power in terms of the mechanism of information that it transmits in terms of pain. And then more at the cellular level, that this can take a little bit longer to see the effects, anywhere from like 8 to 12 weeks. There's going to be stimulation of blood flow, microcirculation. There's going to be stimulation of release of growth factors, which help with healing. It can activate stem cells. It decreases inflammatory effect. It has an anti-fibrotic effect, so decrease in scar tissue formation. And it also has collagen synthesis. It promotes collagen synthesis. So if you have been to other webinars where we've been talking about platelet-rich plasma, PRP, and other type of therapy that we offer, you can see some similarities in terms of the changes at a cellular level that we can expect with both of them. Obviously, they're going to work differently, different mechanism, different time frame, but they definitely share some similarities in terms of the cell changes. Next. So over here is a depiction of all the different ways that have been suggested how the shockwave therapy works. We don't have to go into detail with this. I just want to kind of have you see that there's many ways that this works, being by structurally changing the tissue that we are addressing, or changing the conversation of the cells and growth factors. This is going to increase the blood supply, increase more collagen production, and at the end cause healing of the tissues. So getting into what we can treat with this type of treatment, and that is basically a lot of the things that we treat on a daily basis in the office. So chronic tendinopathy, tendon injury that has been going on for a while. Osteoarthritis can be treated with shockwave. Bone marrow edema, non-union fractures, myofascial pain, muscle spasms, trigger points, plantar fasciitis, among other conditions. Within the tendon injuries, I just listed a couple. There's so many tendons that can be treated with this. These are the most common ones that we treat. The Achilles tendon, patellar tendon. We treat tennis and golfer's elbow, which is like the same as inflammation or tearing of some of those tendons that attach to the elbow. Rotator cuff tendinopathy. This is the example of this picture that we see here. This is an X-ray of a shoulder that has some calcifications over the rotator cuff. And we can treat those calcifications and injury of those tendons. Also, gluteal tendinopathy. Some patients have lateral hip pain. Many people know it as trochanteric bursitis, but at the end, the deep inside is what's causing some of the symptoms is tendon injury in that area. So this is a study that a meta-analysis of some randomized controlled trials. So this is a good summary. Basically, this author did a little bit of work for us. They reviewed 29 controlled trials, randomized controlled trials, which are good quality trials. And then they compare how the patients did in terms of treatment with shockwave therapy. So 29 trials, obviously all of them had different protocols, some similarities, some differences, but they could see that in general, it was a really positive overall effect in terms of decreasing pain and increasing function. This study, this research paper specifically focused on lower extremity tendinopathy, but basically you can extrapolate this for other tendons in the body. So in general, they did see that high dose focused shockwave had a little bit of a better effect compared to the radial or other treatments, but they did see that there was a good result using all of them. And most importantly, all of these 29 separate studies came back with no serious complications reported, which is important. There were just a few minor side effects. Some included skin irritation, transient reddening, or bruising or swelling, but no serious complications. This study specifically, it was just a small study and just 24 patients, and it was not a control or placebo group. But I wanted to include it because Achilles tendinopathy is a difficult condition to treat. You know, the Achilles is a difficult tendon to just rest. You're walking every day, so it's difficult to provide long-term benefits. And they did follow these patients for more than a year. After a year, more than half of the patients had zero pain and had returned to full activity, which is great. And they did see that when they compared using shockwave, focused shockwave therapy and radial shockwave together or separately, they did see that if they used them together, they had better results. Next. This study was more specific for shoulder injury, specifically calcific shoulder tendinopathy, and they compared focused, radial, and combined shockwave. They divided the patients in 3 groups. One was solely treated with shockwave, one solely treated with radial shockwave, and then the other one was a combination of both. The impressive thing about this study is that all of them saw good results with decreasing the size of the calcifications. They did see better results with the one that used both the radial and the focused one, but it's great to see that all of the groups had good results in terms of the reduction of the calcification. And the good thing is that we can see those changes because we use ultrasound on a daily basis. So if we do an ultrasound in the initial visit that you come in, and then 3 months down, we repeat it, we can actually measure side by side the changes in those calcium deposits. Next. So this is just a cartoon depiction of what we think is mostly causing improvement of osteoarthritis and using shockwave therapy. So if you see over on the left, you see a healthy joint with good bone and covered with articular cartilage. And on the right, definitely there's a lot of changes, a lot of like tissue damage, bone damage, inflammation, swelling. So some of the possible mechanisms of how this works is increasing the, promoting the activity of the osteocytes and chondrocytes. These are basically responsible for producing cartilage repair and bone regeneration. So if we can promote the activity of the cells, then we can improve the quality and environment of the knee joint or any other joint. To be honest, this could be any joint. And it also decreases inflammatory activity inside of the fluid of the joint. Next. This study, they used the shockwave therapy to treat bone marrow edema. So to be honest, I included this because the picture was pretty impressive in my opinion. They compared two different groups. They put 20 patients in each group. One was treated solely with shockwave therapy, and the other one was treated with intravenous medications indicated for the treatment of bone marrow edema. The shockwave therapy group ended up having greater improvement in pain and in function, and resulted in more rapid resolution of the bone marrow edema. So this picture that you see over here, the picture on the left is the MRI of a 62-year-old male. This is his knee, and it's very evident that bone marrow edema right there in the lighter color of the MRI. The picture on the right is the MRI of this same patient repeated at 6 months. So definitely shockwave therapy was thought to be produce rapid pain relief and good functional improvement for these patients. And they also ended up following these patients for like a year after, and all the patients treated with shockwave therapy had resolution of the bone marrow edema, while some of the patients that were treated with just intravenous medications were still having some remnants of these findings. Next. So what you are gonna expect in terms of treatment in our office. So when you come in, we're gonna first, as usual, we're physical medicine and rehabilitation specialists. So we're gonna focus on the physical examination and adequate diagnostic ultrasound to visualize the areas that need treatment. So we have to first have the correct diagnosis in order for this to help. So we can identify tears, calcifications, and then do a very targeted treatment. So in this picture, you see the radial device. That radial device on the front of the device, the tip of the device can be changed. Different sizes, different materials, some metal, some different materials that are indicated for different types of injuries. So we have a different selection that is going to improve the chances of you having good results with it. We're also going to be choosing how many pulses you're going to need, what type of energy in terms of high or low energy you're going to need, and the frequency of this shockwave treatment that you're going to be having. These energies and frequency can increase depending on the sessions that you have. And it's going to be very important for you to have a good conversation with your doctor, because when we go over certain areas, you might have a little bit more soreness or more pain. And this will give us some indication of where the injury might be localized. So sometimes even the MRI doesn't show something, but with these devices, we go over certain areas that are very specific, and patients tell me like, oh no, that's exactly the pain that I'm coming to see you for. So then we localize the treatment around those areas. So we always have to use a gel before we use the applicator, because that's going to be the one that conducts those sound waves into deeper tissue layers. And then we're going to be scanning the treatment area back and forth to treat the specific localized pain generator, but also all the tissue groups around it that cause some symptoms. Next. So in terms of actual treatment, each session is going to be around 15 to 20 minutes. Usually we recommend one session per week, anywhere from 3 to 6 weeks. And it's important to know that we can combine this with other types of treatment. This doesn't have to be a sole treatment. It could be combined with massage therapy, with physical therapy, with other type of cell-based therapy that we do here, with PRP. So it's something that it's going to be part of the treatment plan, but it doesn't have to be solely that. Although we have a lot of patients that really like the non-invasive characteristic of this treatment. I had a patient that was a dancer, and yeah, she did have Achilles tendinopathy, but she had a lot of like tendon issues, plantar fascia. So with this type of treatment, we can definitely treat multiple areas in the same region. And that in order to treat that with like certain types of injections or other types of therapy that we offer, it's going to be a lot of more regions that we're going to be treating. So that's good to know. Next. So there's just a few risks and side effects to this therapy, to be honest. Might be minor discomfort, immediate during or immediate after treatment. Most patients report some soreness. Patients that have some calcifications might have a little bit more discomfort than patients that have just a little bit of tendinopathy. But it's all patients usually tolerate it really well. There might be some minor skin bruising, reddening, or swelling around the treated area. We do recommend that the patient stop any anti-inflammatory medications before or after treatment. This is more to kind of not counteract the changes that we're trying to cause in the soft tissue that we're treating. There's still some studies going on that. So if there's any changes in that, then we'll change our recommendations. And we also recommend to the patient to drink plenty of water, stay hydrated, almost like the same as when you go to a massage. So just to make sure that all that the area is really well, you are very well hydrated.
One thing that I would want to add to that, Dr. Diaz, is if the patients had cortisone shots, we want to wait at least about 6 weeks is what's recommended before we do this therapy as well. And that's for the same reasons why we stopped the anti-inflammatories and also to decrease the skin side effects in the treated area.
Yeah, that is true. And also if we're adding this to other types of treatment like PRP injections, we're also going to have certain time frame in between the injection therapy and the shockwave therapy as well. There are some contraindications as with any other device or therapy. We usually won't treat patients with serious cardiovascular disorders, patients with cardiac pacemakers, any malignancies or cancers, patients that are pregnant or breastfeeding, patients with deep vein thrombosis or areas too close to the lung. Okay. So this is basically the take-home points of this presentation. So as we learned, shockwave uses sound waves to promote tissue healing. It stimulates blood supply, growth factors, and collagen synthesis. All these things are going to promote healing of the injured tissue or orthopedic condition. This is a safe, effective, and non-invasive, innovative treatment option for musculoskeletal conditions, including tendon injury, osteoarthritis, and bone marrow edema. And this is an evidence-based treatment supported by research, and it should be used under physician supervision. So now we're ready for your questions. Thank you for your attention, and thanks for attending this webinar.
Thank you, Dr. Diaz. I'm actually sitting here in front of our BioWave device. I thought I just might show you real quickly, quick 1-minute demo of what you might expect. One of the common questions we get is, hey, I'm already in pain. Is this procedure going to cause more pain? And obviously, none of us would want to come to work every day if we were causing a lot of pain for people. So whether it's an injection or BioWave or any other treatment we do, we try to maximize the comfort of any procedure we offer. So I'll just show you real quickly. So the specifics will vary depending on the condition. Acute injuries require less treatment. Chronic injuries require more treatment over time. There are studies that show that if you can handle more energy in one session, you may need fewer sessions. We treat folks once a week with a mildly to moderate amount of energy based on your comfort level. I've treated many patients, including myself, and I find that with each subsequent treatment, as the tissue heals, you tolerate more. It's kind of analogous to any of you who've had massage. You know that first time they get their thumb into your muscle, you go cross-eyed. But then with subsequent passes, that muscle relaxes, and it's sort of the same thing with this. Your body kind of habituates to the intensity, and you tolerate more intensity as the muscle relaxes, but also over time as the tissues heal. So this is the radial shockwave device that Dr. Diaz was telling you about. There's a little impeller, a little metal device, a little pellet, a little bullet that impacts the applicator here, and when it hits that, it creates a sound wave which sounds like this. See if it works. Uh-oh, there we go. So you can hear the sound, and of course we can adjust the intensity for strong, stronger or less strong, depending on your comfort level for that day. But I can tell you at this level, which is pretty normal level, I can put it on my hand. It's very well tolerated. Although if I had arthritis in my hand, I might not tolerate that intensity as well. So that's the radial shock wave. This is useful, as Dr. Diaz said, for sort of a regional treatment. So we think it's important not to just treat, for example, a tear in the tendon in your elbow, but all the muscles in the forearm, maybe even up in the arm, some patients even in the shoulder, because as all of you know, when you have these injuries, other tissues become involved, and so you can get pain in them as well. So this is helpful for doing the regional treatment. For more focused treatment, so maybe specifically for that tear that we've identified on ultrasound, and what we'll do is we'll see exactly where that little 2, 3, 4 millimeter tear is. And then we'll use this device, which will create the deeper penetrating, more focused energy that you hear. This is appealing because it can actually transmit 5 to 6 inches all the way down into bone, as you heard Dr. Diaz say. And that's one of the things that intrigued us, because we have a lot of patients with bone-on-bone knee arthritis. Their cartilage is worn down so bad on their knee, and now their bone has started to bruise. That's that bone marrow edema that you saw on that MRI. And a lot of times when you inject the joint space, the cells don't work their way into the bone. And so a lot of times what we'll have to do is actually drill into the bone and inject cells into the bone. This might be an alternative. We don't know. We're still exploring. But this is an intriguing alternative where we're actually transmitting sound waves deep into the bone to help heal that bone. And by the way, this modality has been used for patients who have fractures that don't heal, what they call that a non-union, other type of bone lesions that are not healing as you would expect them to. So we're very intrigued by the possibility of having a treatment that reaches that far into the body, that's non-invasive and safe, and shown in clinical trials to be effective. So that's focused shockwave and radial shockwave.
Yeah, so as you can see, there's behind Dr. Rogers there's 3 hand pieces that we use for your treatments. You saw, so Dr. Rogers is showing you that's the first hand piece that we use, which is it's a vibrating hand piece that helps massage muscles around the area. It's kind of, don't massage the computer. It's kind of like
nice.
What they call those little Theragun. It
Like
works kind of like a
massage
Theragun.
gun.
Yeah, massage gun. And it helps improve microcirculation. It helps relax the muscles. It helps relax the patients, help with the pain. It preps the condition. And then for all our treatments, we use both the focused and the radial shockwave. You saw the data that Dr. Diaz showed, how the combination of both were better than just single treatments. So in almost all, I don't know about you, Dr. Rogers, Dr. Diaz, but we use both focus and radial for all the conditions that we treat, because we want to give the best benefit to our patients. So you get those 3 handheld devices during the treatment.
And if we really like you, we also schedule a massage with Vanessa, who you'll meet at another webinar at some point, our holistic health practitioner and massage therapist. We figured if we're going to if we're going to hit you up with these different treatments, we should do something nice to do as well. So, so that's another service that we'll be offering.
Yeah, I mean, there's a lot of data now with regards to tendon injuries are caused by these trigger points, and there's myofascial units that's like really tight and creating actually the tendon injuries, and not just as a result of the tendon injuries. So in order to treat your tendon injuries better, we also need to treat the muscles around it, either through massage, through, stretching, acupuncture, yoga, all these other treatments. So there's a lot of questions. There's a lot of interest in this. This is super exciting. Dr. Rogers and I, we tried to answer some of your questions and typed in some of the questions already. But take a look at it, Dr. Rogers, and answer any questions. One of the questions says that can PRP treatment help osteoarthritis with spinal conditions? Yes, that's a PRP question, but the reason why I pointed that out is patients always ask, can I do this in addition to my PRP injections? Should I do it before the PRP injection, or should I do it after the PRP injection? There's been some data that shows that the shockwave actually stimulates the growth factors and enhances the effects of the PRP. So in some, especially the chronic conditions, it helps them better if we follow the PRP injection with shockwave therapy. There's also some data to show that if you prep them with the shockwave therapy first before the PRP, that actually helps optimize, the tissue and the injury to better receive the PRP and have a better result as well. Usually those patients with acute injuries would probably benefit from that, wherein we do the shockwave to help decrease the inflammation, decrease the pain, and then follow it with the PRP therapy.
One thing we're doing, I think that's important in this clinic, is we're actually tracking our clinical outcomes. So every patient who receives any of these therapies, we're tracking the outcome. And the reason we do that is not because there aren't good scientific studies out there. There are good published scientific studies. But for every one patient who ends up in a clinical study, there's another 100 patients who are being treated by a doctor somewhere, and their outcomes are not being tracked. And so we thought that was a problem. So we developed software that allows us and over 100 doctors around the United States, for that matter, to track their outcomes so that we can each compare how our different treatments are working for different conditions. There are so many different types of knee arthritis. For example, if we just looked at knee arthritis, there are probably a dozen different categories of knee osteoarthritis. So it would be very difficult to do a study of every possible treatment for all those 12 different types of knee osteoarthritis. So having this real world data is very helpful. And we're going to try to answer the question, when is something best treated with PRP? When is it best treated with BioWave? When should we do both? Should we do one first and then the other second? Right now, we're making those decisions based on our training and our experience and our education and the published literature. But we have this ongoing learning experience where we're collecting data on our patients. We're comparing it to this nationwide database so we can truly get to a quicker understanding of what is the most cost-effective way to treat a given condition.
Dr. Diaz, there's a question here regarding icing after a shockwave therapy. What do you think about that?
I think it's similar to what we do with PRP. So immediately after, if the patient has a lot of pain, it might be helpful to kind of calm it down a little bit. Sometimes we prefer heat because the heat actually promotes blood supply to the area. So if it's more a matter of like being a little bit of uncomfortable, I think heat will be preferred. But if it's kind of sore from the treatment, a short-term use of ice, it will be okay.
Thank you. Thank you for that. Okay, let's see what other questions we have. There's a question here regarding a middle finger that was injured when the wrist was broken, requiring surgery. I've been told that the tendons or ligaments in my finger were damaged when I fell. I can't straighten out my finger and knuckle is enlarged. Would this treatment help my finger?
It sounds like that's a case where this person has arthritis in the joint, so there may be damage to the cartilage and to the other tissues in the joint. In addition, there may be some injury to the soft tissues around the joint, the ligaments and the tendon fibers. So this is one of those cases where no one's done a published research paper on your specific injury, and we have to bring our experience and knowledge of the injury to your treatment plan. This would require X-ray and possibly ultrasound examination as well as physical examination to get a better idea of what actually is going on there and what is missing. You know, your body is constantly trying to heal. I tell people it's like your lawn in your yard. It's constantly wanting to grow, but if it's not growing, it's missing something. It's missing an ingredient. Either you're not watering enough, you're not fertilizing enough, or you put too much furniture or playground equipment out on your lawn and it's inhibiting the lawn from growing. So the same is true with these conditions. Now, some conditions will heal to a certain point, at which point they cannot heal any further. They've just done the best they can. But in many cases, the healing was arrested for some reason and it didn't complete, but it still has the potential to get further healing. So in the cases where the bone marrow is bruised, in the cases where the joint is inflamed, in the cases where connective tissue, such as ligament and tendon, is torn, all those are injuries that can be re-stimulated to go on to further healing.
Okay, I'm just answering some questions here. Any head-to-head comparisons of shockwave to PRP? Do you know of any studies, Dr. Diaz?
So there have been some studies regarding this. What we think at this point is that they have similar benefits, but the PRP will have long-term benefits in terms of the shockwave. So the shockwave might have some benefits, but it might not last as long as with the PRP. I think we were talking about a paper this morning with Dr. Rogers in terms of that.
That was specifically for the rotator cuff tendon. So it might be different. As we said, every condition, you know, is unique. So that which was observed in that study where patients responded more quickly with the BioWave treatment, but the results lasted longer with the PRP treatment. And that's not surprising given our experience with some of these cell-based therapies. Their biologic effects can last for years. So I think it remains to be seen how long the biologic effects of shockwave. The nice thing about shockwave is because it's relatively non-invasive, is something that can be repeated. So typically we'll do our treatment, 4 treatments or so once a week apart, and then we'll just let the healing effects occur and do nothing to the injury for another month or 2 and see how far it can heal on its own. If you don't achieve a level of satisfaction after that time period, then that's a point where we could maybe reinitiate some BioWave treatment and therefore prolong the effect of the pain relief and the healing.
There's some questions here regarding osteoarthritis. I think that's one of the most common indications where we use shockwave therapy through a lot of different mechanisms. It can help the pain and inflammation of your osteoarthritis. Same thing with this question regarding a gentleman having a meniscus repair on both knees, but now he's hurting again. And the question is, will this help with the repair? As you can see, Dr. Diaz showed the different mechanisms by how shockwave helps, increasing blood flow in the area, decreasing the pain, stimulating the stem cells, stimulating growth factors in the region. All of those are mechanisms that will actually help facilitate the repair of your meniscus tissue. As you know, meniscus is hard to treat when it has injuries because it doesn't have a lot of blood supply. So it needs all the help that it can get to create an environment to help it heal. So to answer your question, yes, even though you're 69-year-old, you're an active guy, this will help facilitate the repair in that knee.
Can I add something, Dr. Ambach, to that? So if you were 20 or 30 years old and had a tear in your meniscus, there is the possibility that a surgeon can repair that. However, typically, if you're older than 30 or 40 years of age, the surgeon will not attempt to repair it. They may tell you that they repaired your meniscus, but in reality, what they did is they shaved down pieces of the meniscus that were fractured and fraying off of the meniscus. because we know that when these little pieces break loose, they can promote inflammation and pain. If they're large enough, they can actually affect the motion of the joint. So typically what it really is more of a what we call a debridement. So you imagine this meniscus, it's not just a clean tear where the surgeon goes in and sews it up like if you had a cut on your skin. Instead, it's a degenerated, I always say it looks like a dog chewed up your meniscus, and it's broken into lots of little pieces, and the surgeon will do their best to smooth out the contours so that pieces don't continually break off the meniscus. What we know two things from the published literature. There's a small subset of patients who will benefit from that type of procedure, but there's a larger group of patients who will not. And in fact, they will more quickly develop osteoarthritis in their knee. So it's a known fact that people who have meniscus surgery, meniscectomy as it's called, are more prone or more quickly prone to progress to severe osteoarthritis and need further treatment. So more than likely the pain that you're experiencing, and we can evaluate this in the office, but more often than not, it's not a meniscus pain issue per se, as much as it is a progression of the osteoarthritis, which means that the other cartilage in the knee joint, the articular cartilage, is being damaged, and there may be inflammation of the soft tissues in the joint. And those can all be treated with a variety of different means that we have developed here in the office.
That's right. Thank you for that explanation, Dr. Rogers. There's an interesting question here, and it's a valid question, but I want either of you to answer this. So it's a patient that has a bone spur in the spine because of disc degeneration. And it was mentioned that because this helps with bone regeneration, does that affect the bone spur? Does that make the bone spur worse? So I'll have you answer that question.
I can answer that question. Your body is very smart. Just because you add something to the system, so say you're low in calcium, just because you add a calcium pill to your diet doesn't mean that you can overdo it, because most of the times your body will excrete the extra calcium you don't need. I'm not suggesting that that's the problem in the case of a bone spur. What I'm suggesting is that in the case of a bone spur, it's a dynamic process. Your body is growing bone and it's also degrading bone at the same time. So if you can stimulate the system to give it what it's missing, then you can promote healing. But a bone spur typically is not affected by the BioWave treatment. We do not see bone spurs get bigger. We also do not see them get smaller. The same is true with stem cell therapy. If you inject stem cells into the joint, you do see cartilage grow in the joint, but you do not see the bone spurs getting larger or smaller for that matter. So there's something about the biology of a bone spur that it just likes to be the way it is. But it's for sure it's remodeling over time, but it's not necessarily getting larger or smaller.
We have a physician from I think India. I don't know if I
Welcome.
got your welcome to our webinar.
3 in the morning or something.
Okay.
So he has a question regarding MRI changes post shockwave treatment. And I don't know if you remember Dr. Diaz's slide regarding that bone edema, which is basically a bone bruise that improved. How long after did they see the improvement in the MRI?
It was the picture that I showed was 6 months.
6 months
After the treatment. Yeah.
Right. So yes, in certain conditions, you can see MRI changes. As you know, imaging studies don't always correlate with symptoms. So we always go by patient's exam and patient's functional status. As a follow-up question, this physician had the question regarding a 29-year-old female with severe patellofemoral wear and tear changes. She responded to 3 sessions of shockwave therapy a week, and then her pain level is now at 3 compared to 8. So the question is 3 sessions enough, or do we need more of the shockwave therapy? Great question. The recommended therapy is anywhere from 3 to 6 sessions. The minimum therapy that I would recommend, I think, is 3 sessions. That's usually when patients start seeing the benefit. But the more severe treatments might need, 5, 6.
sorry to if I may add, it's a very valid question, which is why we're tracking our data to see what protocols are going to give us the best results. And, we all know exercise is good for us, and exercising 4 or 5 days a week is good for you, but probably exercising 4 or 5 times an hour would not necessarily give you the same results that you would want. And so I always say too much of a good thing is not necessarily a good thing. And so there is going to be an optimal therapy that's going to give you the best results. Don't forget, when we do shockwave, if we increase the intensity enough, we can induce little micro trauma. And there have been studies that show you can actually induce little microscopic fractures within the bone. It doesn't break the bone, it actually stimulates the bone to heal, but the body's going to need a week or 2 to recover from that therapy, just like your body needs time to recover from the micro tears in your muscle fibers when you lift weights or exercise. So you're not destroying yourself, but you are creating these microscopic injuries that do take time to recover. And it probably takes more than just a couple of days to recover, probably a week to 10 days in most cases.
I think it's also, important to know that this type of treatment, as we saw there, like the mechanical component of it and the cellular component of it. So after 3 or 4 treatments, they might be that immediate kind of pain relief, but in terms of healing tissue, and the patient can continue getting further benefits from it down the line, even like 2-3 months after, even when the therapy, the shockwave therapy had not been received for a few weeks.
Yeah, that would be a great way to end this webinar, with Dr. Diaz having the last word there, since this is her presentation. Her slides are great. We're gonna give you a copy of our webinar presentation in our YouTube channel, so you can access her slides. You can access our presentation in our YouTube channel. If you have any more questions, feel free to call us in the clinic. Did we put some information in our website already, Dr. Rogers?
No, we haven't. We need to do that.
Yeah, we're gonna put some information with regards to links and resources in our website. We already have a list that we can email you if you're interested to read studies on this, and you like to read research. We've got a whole list for you to read on. So thank you so much for joining us. Next month, we're gonna do an Ask the Docs session. So we're gonna go live on Facebook, and this is a 30-minute question and answer session wherein the whole time is devoted to answering your questions regarding the topic for that session. So we haven't decided on the topic yet, but we'll let you know soon. But thank you for joining us. Dr. Rogers, any last words?
Yeah, thank you again for joining us. I hope some of you come in and try this new treatment. I think you'll find it enjoyable and very effective. I know I have, as I'm getting older.
We all have tried it.
All right. Have a good afternoon, everybody. And thank you again for your time. Bye.
Bye.
Bye.